My name is Ketty Ruiz. I work as a pelvic floor physiotherapist in Palma de Mallorca, and I am an expert in non-invasive modulation. Today I am here to present the case of a patient who came to the clinic after 2 years of painful bladder syndrome evolution. These patients are often confused with recurrent urinary infections because the symptoms are very similar: the same urinary urgency, the same burning sensation, the same pain in the area, the same dysuria or pain during urination or when the bladder is full and needs to be emptied. The symptoms are very similar and, as they occur in the same area, patients get confused and think they have a urinary infection. Instead of going to their usual urologist, they end up going from one emergency clinic to another. When you arrive with these symptoms, it's common to be diagnosed with a urinary infection and be given antibiotics, which would be correct for a urinary infection. Our patients may receive between 10 and 20 antibiotic treatments a year for infections that don't exist, so they are completely useless. The patient came with a 2-year evolution of painful bladder syndrome. She had seen various urologists, gynecologists, and had taken all the antibiotics available, until a friend suggested trying a center specialized in pelvic floor physiotherapy. When she came to us, her EVA scale was 8 out of 10. All day, every hour, only feeling well when lying down. We then started our usual treatment, which is manual therapy of the entire area, all the pelvic floor muscles, the entire territory of the pudendal nerve, external pelvic manual therapy, and soon started a treatment with NESA. It's true she was a very complicated patient. The programs we always use are program 1 for half the session, and we also use programs 7 and 8. Our patients with chronic pain have a very important level of anxiety, and in the first sessions, we use these types of programs. As we can reduce program 1, we add more time to program 7. In this patient, from the 4th session, we were able to withdraw program 1 without any rebound effect and began to focus on areas related to the bladder. We placed a director at L1 L2, where we have the medullary cone close to the thoracic orthosympathetic center, using programs 2 and 7 for half an hour each. After 4 sessions, we were able to lower to S2 S3, where both the ONIF nucleus of the pudendal nerve and the sacral parasympathetic center are located. There we changed to programs 2 to 3 and 7, the latter for half an hour. After 4 more sessions, we moved to the inferior mesenteric, going down towards the suprapubic, adding a bit of program 2 and a lot of program 7. 6 sessions later, we moved to the nasion, the nasofrontal suture, adding programs 2 and 7 to act on all supramedullary centers related to the bladder. Currently, the patient has a monthly reminder session, not because we scheduled it, but because she calls us monthly saying she starts to feel a bit worse and needs her NESA boost. Depending on how she feels, we schedule the reminder sessions. 3 months ago, her father became very ill and died, and she had a brutal period of anxiety, which is normal. But due to her nature, she did not report that she had to bear the whole weight of her father's death, keeping it all inside, and her vesical and pelvic symptoms worsened so much that she thought she was back to square one. There we changed the protocol to an anxiety protocol. What we did was set up a direction route where in the same session we would go from the inferior mesenteric to suprapubic, a 2 and a 7, and then up to the external manubrium with another 7 and 15 more minutes of 7 and 8. In 3 to 4 more serial, more frequent sessions, the patient began to feel better and is currently working normally, has a normal family life, can have a social life and go out to eat or dinner with friends without having to go home because she can't bear to sit down. She carries her cushions everywhere, though. And she has started the pelvic floor therapy group, which she is ready to seriously strengthen the whole area and is very happy. It's curious because thanks to NESA, we have realized that patients who were previously considered hopeless can start to come out of the well and accompany them in their process. Seeing how their lives change for the better makes our profession very enjoyable. Thank you very much for listening.